Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Levofloxacin. Its brand name is Levaquin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Levofloxacin is a quinolone or fluoroquinolone antibiotic. Its mechanism of action involves the inhibition of topoisomerase 4 and DNA gyrase. These enzymes are required for DNA transcription, replication, repair, and recombination. In terms of indication for use, levofloxacin can be used to treat acute bacterial exacerbations of chronic bronchitis. It can be used to treat bacterial conjunctivitis as well as bacterial prostatitis. We see levofloxacin used to treat community-acquired and hospital-acquired pneumonia. It can be used for some urinary tract infections. It can also be used to treat some infections of the skin and subcutaneous tissue. And we also see levofloxacin used to treat acute pyelonephritis. Now, before somebody was to use levofloxacin, there is a contraindication that they must clear, which in this case would be a hypersensitivity to levofloxacin or other quinolone antibiotics. And there's also some warnings and precautions that they should be made aware of. QT prolongation has been reported with the use of levofloxacin, so we want to avoid giving this medication to patients who have a known presence of QT prolongation. We would want to avoid giving this medication to patients who have uncorrected hypokalemia or low potassium. Moderate or severe photosensitivity has been reported with the use of levofloxacin, so it's a good idea not to expose yourself to too much sun or UV light. It's important that patients are made aware that fluoroquinolones in general have been associated with disturbances in blood glucose levels. This could present as hyperglycemia, high blood sugar, or hypoglycemia, low blood sugar, and patients would be at an increased risk of experiencing either of these if they were a diabetic patient using hypoglycemic drugs. Hepatotoxicity has been reported, and more likely to be reported in patients who are greater than 65 years of age. Serious and occasionally fatal hypersensitivity reactions, including anaphylaxis, have been reported with the use of levofloxacin. Patients with a history of tendon disorders or rheumatoid arthritis may want to avoid using levofloxacin because they could be putting themselves at an increased risk of experiencing a tendon rupture. You would want to use this medication cautiously in patients who have renal failure or renal dysfunction. And lastly, for precautions, elderly patients would be at an increased risk of experiencing QT prolongation. Now, once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use levofloxacin, they can expect to receive their dose orally or intravenously. If somebody is using levofloxacin to treat community-acquired pneumonia, they can use levofloxacin oral tablets or the intravenous solution using 500 milligrams once daily or every 24 hours for about 7 or 14 days. Alternatively, they could use 750 milligrams, again given orally or intravenously, once a day for 5 days. If somebody is using levofloxacin to treat an infection of the skin or subcutaneous tissue, and it's an uncomplicated infection, they can use 500 milligrams once daily for 7 to 10 days. If this infection is complicated, however, they may use 750 milligrams once daily for 7 to 14 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using levofloxacin, so I'll go over some of those here now. Some patients may experience diarrhea or nausea. 3% of patients may experience dizziness. Headache may happen between 6 and 10% of the time. And insomnia may happen in 4% of patients. Now, some more rare but serious side effects would be QT prolongation, the development of Stevens-Johnson syndrome, hypoglycemia or low blood sugar, hepatitis or liver failure, disorientation or disturbances in attention, the rupture of a tendon, delirium, depression, or hallucinations. That's all we're going to talk about today with levofloxacin or Levaquin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.